Hi, my name is Kelly. I'm from the U.S. and I just had my left hip replaced. I'd actually been experiencing pain for almost a decade. I had a surgery 7 years ago to fix a torn labrum in my hip joint, and then about 5 years later I started experiencing pain again, and I kind of just dealt with it because I didn't want to have another surgery, and I thought maybe it wouldn't get any worse, but it got to the point where, everything was painful. Walking, working out, sleeping. I couldn't dance anymore. So I got to the place where I knew I needed to have a surgery. But surgery in the U.S. is really expensive. So I knew I couldn't afford it. So I started working with different medical tourism companies. And I found a company that told me about Dr. Subhash here at Fortis Hospital. And I was nervous to come to India, I'll be honest. I don't fit in. Everybody stares at me, and I hear a lot of things about the safety in India, so I wasn't for sure that I wanted to come here. But the company I worked with assured me that they would take care of me, which they really did. And then I also had the opportunity to speak with a woman who had just had a surgery from Dr. Subhash, who is also an American. And she had nothing but amazing things to say about him and her recovery and the care at Fortis Hospital. So I had a lot of confidence coming in here. And I did my research on Dr. Subhash as well, and I found that he's the only doctor here in the area, I think maybe even all of India, that does the NAV3 for joint replacement. So that made me feel really confident too, because it wasn't going to be any sort of outdated technique. It was going to be state-of-the-art technique. And I am actually really surprised at how great I feel. I had my surgery on the 4th. Today is the 8th, and I'm already getting discharged and walking with the cane. In the joint itself, I have no pain, which is a relief. I've lived with pain in that joint for 10 years. So right now, the only pain I'm experiencing is in the area where the incision is and the surrounding muscle and tissues, which is, absolutely normal. But I felt like Dr. Subhash and his team were really competent. He was able to answer all my questions. I ended up finding out that what the real issue was, that's my phone ringing, sorry. What the real issue was with my hip originally was not a torn labrum. I actually had some physical trauma at some point in my life, which caused part of my bone to die, which then caused these physical deformities on the ball of my leg bone, which then was causing all this irritation in the joint, and that's where my pain was coming from. That's where the osteoarthritis was coming from. And so with the help of Dr. Subhash and a couple of other medical opinions, I was able to make a really informed choice about my surgery.